How does Y-BOCS measure OCD symptoms? Imagine trying to understand how much OCD affects someone. The Yale-Brown Obsessive-Compulsive Scale, or Y-BOCS, helps clinicians do just that. It's a structured interview that looks at both obsessions and compulsions separately. The clinician asks detailed questions about what the person experiences and how severe those symptoms are. It has two main parts. The first part is a checklist of symptoms, and the second part is a severity scale with 10 questions. Each question is scored from 0 to 4, where 0 means no symptoms and 4 means very severe symptoms. The questions focus on how much time the symptoms take, how much distress they cause, how much they interfere with daily life, how resistant the person feels to the symptoms, and how much control they have over them. For obsessions, the Y-BOCS asks about how much time obsessive thoughts take up during the day. It also asks how much these thoughts interfere with daily activities. The clinician checks how distressed the person feels because of these thoughts. Resistance is evaluated by asking if the person tries to ignore or stop the obsessions. Control measures how much they feel they can manage or suppress these thoughts. When it comes to compulsions, the questions focus on how long the person spends performing repetitive behaviors. The clinician asks about how these behaviors interfere with work or social life. They also ask how distressed the person feels if they cannot perform the compulsions. Resistance is assessed by asking if the person tries to resist or stop the compulsive behaviors. Control is about how much they feel they can manage or reduce these behaviors. After all questions are answered, the scores for obsessions and compulsions are added together. The total score can range from 0 to 40. A score of 0 to 7 suggests symptoms are subclinical, meaning very mild or not noticeable. Scores from 8 to 15 indicate mild symptoms. Moderate symptoms are scored from 16 to 23. Severe symptoms fall between 24 and 31, and scores from 32 to 40 show extreme severity. This scoring system helps doctors understand how much OCD impacts a person's life. It also guides treatment decisions, such as whether therapy or medication might be needed. The Y-BOCS is designed to be reliable and consistent, even if a person has many different types of obsessions or compulsions. It also allows clinicians to ask follow-up questions and gauge insight, or how aware the person is of their symptoms. While the Y-BOCS focuses on severity, it does not directly measure other features like avoidance behaviors, but it provides a clear picture of how much OCD symptoms are affecting someone. In summary, the Y-BOCS measures OCD symptoms by carefully quantifying how severe and disruptive obsessions and compulsions are. It uses a standardized interview process that helps clinicians track changes over time and evaluate how well treatments are working. If you or someone you know is dealing with OCD, it's important to consult a healthcare professional who can use tools like the Y-BOCS to get an accurate assessment and develop an effective treatment plan.